Ketamine. Ketamine is a synthetic non-barbiturate injectable anesthetic agent initially produced in 1962 while searching for an alternative to phenylcyclidine, hence it's a phenylcyclidine derivative. It's used for a range of things including anesthesia, sedation, analgesia and prolonged neuroaxial blockade. It's presented as a clear colour solution at varying concentrations, 10, 50 and 100 milligrams per ml in either dextrose or sodium chloride. The CNS effects are due to non-competitive NMDA receptor antagonism plus or minus GABA A receptor involvement, and this activation of the sympathetic nervous system is due to inhibition of catecholamine uptake. The doses vary for induction, but IV will be 1 to 2 milligrams per kilogram, IM is 5 to 10 milligrams per kilogram, and a significantly lower dose of 20 milligrams for analgesia. Onset is less than 60 seconds. Systemic effects are broad and relate to the activation of the sympathetic nervous system, so you get an increase in respiratory rate and bronchodilation, whilst unlike propofol, laryngeal reflexes are preserved. Cardiovascular effects: increase in heart rate, cardiac output, blood pressure, myocardial oxygen consumption, whilst myocardial depressant effects are also seen. This is due to blockade of the ATP sensitive potassium channels. CNS: increase in cerebral blood flow, CMRO2, ICP. It is a dissociative anesthetic with an emergence phenomenon, amnesia and analgesia. Hypersalivation and cystitis have been observed. Absorption is via a range of different routes: IV, IM, PO, subcut, intranasal, rectal, epidural, intrathecal. Distribution: it has a low protein binding relative to other agents. It has a large volume distribution of 5 litres per kilogram due to its high lipid solubility. Its pK is 7.5, so it's 50% unionized. And the offset is due to redistribution. Metabolism: it undergoes extensive metabolism, especially by the CYP3A4 to norketamine, which is an active agent, in addition to minor pathways including hydroxylation. It's eliminated in the urine and bile with elimination half-life of 4 hours. Special conditions relate to those of the CNS effects as described.